Hey guys, how you doing? It's March 23rd, 2010. I would like to read you an article I found. And one of the reasons why I opened this YouTube channel is to vent a little bit about the issues that I think are important. And this is definitely one of those issues. It's called Healthcare Reform Passes. And it is written by a man named Ron Paul. You probably heard of him. And I think he nails this pretty good. This is basically how I feel about the system and passing health care on to people that don't necessarily want it. And there's proof of that in that the states themselves are going to sue and try to get out from underneath this legislation. Anyway, I'm just going to read this article to you. I think you'll enjoy it. Following months of heated public debate and aggressive closed-door negotiations, Congress finally cast a historic vote on health care late Sunday evening. It is truly a sad week in the House floor as we witness further dismantling of the Constitution. Disregarded of the will of the people, explosive expansion of the reach of government, unprecedented corporate favoritism, and the impending end of equality health care as we know it. Those in favor of this bill touted their good intentions of ensuring quality health care for all Americans, as if those of us against the bill are against good medical care. They cite fanciful statistics of deficit reduction while simultaneously planning to expand the already struggling medical welfare programs we currently have. So there's a lot of inconsistencies with it. They somehow think that health care in this country will be improved by swelling our welfare rolls, cutting reimbursement payments to doctors who already are losing money. It is estimated that thousands of doctors will be economically forced out of this profession should this government fuzzy math actually try to become health care reality. No one has thought to ask what good mandatory health insurance will be if people can't find a doctor. Legislative hopes and dreams don't always stand up well against economic realities. So true. Frustratingly, this legislation does not deal at all with the real reasons access to health care is a struggle for so many, the astronomical cost. If tort reform was seriously discussed, if the massive regulatory burden on health care was reduced and reformed, if the free market was allowed to function and apply downward pressure on health care cost as it does with anything else, if prices get too high, you go somewhere else, shop somewhere else. That puts downward pressure on expensive things, including health care. They're not allowing that to work. Perhaps people wouldn't be so beholden to insurance companies in the first place. If costs were lowered, more people could simply pay for what they need out of pocket, as they are able to do before government got so involved. Instead, in the name of going after greedy insurance companies, the federal government is going to make people even more beholden to them by mandating that everyone buy their product. Okay. Hefty fines are due from anyone found to have committed the heinous crime of not being a customer of a health insurance company. We will need to hire some 16,500 new IRS agents to police compliance with all these new mandates and administer various fines. Freedom. Liberty. The pursuit of happiness. Something stinks. So in government terms, this is also a jobs bill. Never mind that this program is also likely to cost the private sector some 5 million jobs. Of course, some troubling aspect of this bill is that it is so blatantly unconstitutional and contrary to ideals of liberty. Nowhere in the Constitution is there anything approaching authority of the federal government to do any of this. Mandating that the citizens buy health insurance. You know, we haven't had health insurance for 15 years. And that's our right to choose not to have health insurance. Some choose to have it, and that's great. But that's everybody's individual choice. The founders would have been horrified at the idea of a government forcing citizens to become consumers of a particular product for a certain government, from certain government-approved companies. 38 states are said to already be preparing legal and constitutional challenges to this legislation. And if the courts stand by their oaths, okay, that's key, if the courts stand by their oaths to uphold the Constitution, they will win. Protecting the right to life, liberty, and pursuit of happiness should be the court's main responsibility. Citizens, last paragraph. Citizens have a responsibility over their own life, but they also have the liberty to choose how they will live and protect their lives. Healthcare choices are a part of liberty, another part that is being stripped away. Government interference in healthcare has already infringed on choices available to people, but rather than getting out of the way, amen to that, it is entrenching itself and its corporatist cronies even more deeply. And friends, if you can't sense that, if you can't feel that or see that happening, you're blind. And I think you need to reach over and take that red pill, the one that wakes you up. Anyway, guys, just thought I'd vent a little bit. Have a great day.